So I'm going to shift gears just a little bit. So Rural Health Transformation Initiative is massive right now, and you've played a huge role into kind of the strategy of what Avel is doing. So let's talk about that from a frontline perspective and what that really means and why is rural health transformation so important right now.
Yeah, I think ever since I've started my career, actually in the Avera Rural Health Institute, rural health has been a focus of ours and understanding the differences in how those communities are set up. And they face a higher disease burden. Often the patient population is a little older.
Yes.
They may have less access to insurance or more poverty. And so there's some barriers to getting healthcare as well. Mm-hmm. And then they're facing dwindling volumes because you see more and more patients or more and more people, just moving into urban areas. So those communities are, slowly shrinking as well. And it's hard to operate a hospital or a clinic when you don't have the volume.
Yes.
And I think it kind of demands a different kind of business model. It really does offer some true economic challenges. And I think what we've seen even lately is still that these hospitals are struggling. I think half of them are operating with negative margins. And so it's just a matter of how long are they going to continue to survive. And yet they could be very critically important to that community. They may be the only healthcare for an hour drive or a half-hour drive. And being there or not being there probably means the difference between patients getting regular care and not.
Absolutely.
In the golden hour of a trauma or a STEMI, getting rapid access to the therapy to help reverse your stroke or mitigate your heart attack. I mean, all of that is in jeopardy. And so we haven't found a good solution for how to operate all of these organizations and keep them viable as the volumes shrink, as healthcare becomes more expensive. The workforce labor rates go up, the supply costs have gone up. And then we see as a nation that we also need to be cost effective. And so you use a crunch from the payer side as well. So it is a concerning outlook for many of these hospitals. And so, innovation becomes that imperative. What are you going to evolve to so that you can survive? Because continuing on this path is not going to be sustainable.
Yeah.
And so we're really fortunate that we've got this $50 billion coming out to support these transformation efforts. And it looks like many different things in many different ways.
Yes.
There's funding for food pantries and walking paths and workforce training programs. Yep. And parts of those really come kind of into our area of expertise, which is how do you provide access and how do you make sure that the technology investment is available for these hospitals so that they can modernize their operation. And so I'm hopeful too, as there's some ideas about payment reforms and how we look at how these services are paid for, that all of that can occur within this 5-year period so we can make some meaningful change. $50 billion is so much money.
So much money. I don't even know what to do with all of it.
Once in a lifetime kind of investment in healthcare. And so it's going to be really interesting to see what changes and what doesn't. I think in this first iteration of funding, you see an emphasis on those shovel-ready projects are ready to go. And so to me, I'm like, are these innovative? Or, is it just like the low-hanging fruit? And so I'm almost excited to get past this first wave a little bit and see we have time to settle into these true conversations about what kind of more radically new innovations can we bring about. How can we support patients in ways that we never would have dreamed because of all the bureaucracy and kind of red tape around how healthcare is delivered. So I'm super excited about it. It has re-energized a lot of people. I've seen many companies thinking, how can we work together? I mean, those conversations probably wouldn't have happened without this funding available.
Yeah. Well, and I think seeing other people wanting to be innovative has been interesting and positive. So when we're looking at that, how do you know if it's a good innovation versus okay, people are just using the money to just try something? How can we play a part in that conversation when people are looking at that?
Yeah, I think we have to be realistic that there's going to be some projects that don't work out.
Yes.
I think there had been, when I was in school, I remember there was some professor talked about maybe 1 in 10 ideas worked out. So
yes,
you're playing with $50 billion. We surely hope it's not that 1 in 10. But
Yes.
I think some things that people are really focused on, which is exciting, is measuring that you're actually making an impact and quickly.
Yep.
And so there's definitely CMS saying if you're not
making your measurements,
we're taking the funding back.
Yeah.
And I think we all should love that as taxpayers. And we want to make sure that, these dollars are being put to good use. But I also think when you're doing innovation, there's going to be things you try that are just fails. And hopefully you are learning from those and you're taking something and moving forward quickly.
Yep.
In healthcare, I feel like the quick part is always a little more difficult. And I know like the fail fast maxim can be a struggle if that's not the culture you're in.
Absolutely.
So I'm optimistic that we're going to get a lot of movement with transformation, but I do know there's going to be projects we look back on and be like, that
was not it.
That was not it. Yeah.
Oh my gosh. So from a market perspective, what is kind of the biggest area that we're trying to evolve into right now from a healthcare innovation perspective?
Yeah, I'm glad you asked about our next big innovation. I think often we've been focused on how do we get a physician or a nurse into the right place at the right moment. But we're starting to see how can we help outside of that moment as well. How can we help a hospital or clinic understand best practices and how they're designing their workflows and how they're delivering care to patients outside of just bringing in our expertise when and where it's needed. And that's really exciting for me. We have emergency providers that are working in over 250 emergency rooms. So they've seen 250 ways of how to do things and really learned a lot about what can work or many flavors of what can work. And working with a hospital hasn't figured it out. You can take that learning to them and help them understand the changes that they can make, coach their team, bring in new resources. It's really exciting. We can help even when the camera's not on.
Wow, amazing.